Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, RHONDA Brooks. It's Friday, October 3rd. Today on HITshow, ChristianaCare breaks ground on a major new health center. Northeast Georgia Health scales ambient listening to fight burnout. And later, we'll turn to a wave of innovation and funding, from Assort Health's big raise to Koda Health's growth round and Everlywell's new AI push. Let's get started. ChristianaCare is in expansion mode in Delaware. Teresa Vaughn has the story.
ChristianaCare has broken ground on a new 140,000 square foot health center in Middletown, Delaware. It's the first major project in an $865 million, three-year capital plan to expand services across the state. The Middletown site will house primary care, specialty clinics, imaging, urgent care, and even a 24-hour emergency department.
Teresa, for a community site, that's a really significant footprint.
It sure is. ChristianaCare says the design is meant to decompress its Wilmington and Newark hospitals and to meet demand in one of Delaware's fastest-growing areas. Leaders point to projections of tens of thousands of new residents moving into southern Newcastle County in the next decade.
And beyond population growth, what's the larger strategy?
It's clearly the hub-and-spoke access model. By moving more services closer to where patients live, ChristianaCare hopes to reduce unnecessary admissions, keep tertiary hospitals focused on complex care, and capture market share before competitors move in. They're also emphasizing hundreds of new jobs tied to the project, reinforcing their role as one of Delaware's largest employers.
As ChristianaCare builds out bricks and mortar to meet demand, other systems are leaning on digital tools to expand capacity in a different way. At Northeast Georgia Health, that means using AI to lighten clinicians' workload. Anika Shah is here with more. Anika.
Hi, Rhonda. As you know, ambient listening technologies are hitting their stride. What started as small pilots and early adopter trials is now moving into mainstream deployment across health systems. Northeast Georgia Health System is one of the latest examples. The system is scaling Dragon Copilot, formerly Nuance DAX Copilot, directly inside Epic, training more than 480 clinicians.
And they're also early adopters for ambient orders, right?
That's right. NGHS is part of Epic's Wave 2 program. It means orders can be captured conversationally, a meaningful step in fighting burnout and reshaping documentation workflows. Leaders say physicians are saving more than 2 hours per day by cutting clicks and letting the AI draft notes in real time.
So this isn't just about reducing burnout, it's changing the way care teams interact with the patient and the EHR.
It's a sign that ambient documentation is maturing beyond proof of concept and becoming a standard tool in the workflow.
That's what's happening with providers on the ground. But another big story this week is money. Investment deal flow is heating up, with capital and innovation reshaping care delivery. Coming up after the break, a $76 million Series B in voice automation, new funding for advanced care planning, and Everlywell's push into AI-driven diagnostics. Stay tuned.
Health 2025 is the must-attend event where healthcare meets innovation. Join thousands of executives, investors, and innovators in Las Vegas this October. Experience groundbreaking content, meaningful networking, and the latest in health tech, all in one place. Visit HLTH.com to learn more.
Welcome back. You're listening to HITshow. Earlier in the show, we shared news relating to the ways that providers are expanding capacity both physically and digitally. Now let's shift to the money side, where venture capital and strategic deals are fueling the next wave of innovation. We'll start with a $76 million raise for Assort Health, one of the fastest growing players in AI-driven patient engagement. Nate Collier reports.
Assort Health, the AI voice startup for scheduling and intake, just closed a $76 million Series B. Its tools automate front desk functions like intake and patient communications. For providers, that means fewer call center costs, smoother throughput, and improved patient satisfaction scores linked to reimbursement.
And that ties directly into value-based incentives.
Exactly. Hospitals that improve patient experience metrics can see that reflected in their financial performance.
Voice and intake automation may reduce friction at the front door, but another challenge hospitals face comes later, making sure patients' wishes are clearly documented. That's where Koda Health comes in. Logan, you were following this one?
That's right, RHONDA. Koda Health has oversubscribed its Series A at $7 million, funding the scale-up of its advanced care planning platform. The software integrates directly with provider EHRs, helping clinicians initiate and document goals of care conversations across multiple service lines.
And that's an area where many systems still struggle?
Yep, they sure do. Without a structured workflow, advanced care planning is often inconsistent. Koda's tools prompt providers, capture patient preferences, and ensure that documentation is visible across care teams. That supports both quality measures tied to reimbursement and the patient experience of having their choices respected.
So, this isn't just about compliance, it's about trust.
Health systems and health plans see it as a way to reduce unwanted interventions, improve alignment at end of life, and build stronger relationships with patients and families.
Sounds like Koda is on the path to saving systems a lot of money while providing patients and their families with a better experience. That's a winning combination. We've covered investment in voice automation and planning workflows, but the innovation wave also extends into diagnostics. A major at-home testing player is now positioning itself as a digital-first platform. Here's Jade Romero.
Everlywell, best known for its direct-to-consumer testing kits, has announced Eva, an AI-powered health platform. The company says Eva will combine at-home diagnostics, telehealth consults, and AI-driven guidance into a more unified patient experience.
So this is about moving beyond testing into actual care?
By layering Eva onto its nationwide lab and pharmacy network, Everlywell can deliver end-to-end services, from ordering tests to getting results to immediate virtual follow-up. For providers, that's both a potential partner and a potential competitor. Health systems could integrate Everlywell's test data into care pathways, but they may also face patient leakage if consumers stick with the platform for ongoing low-acuity care.
And this fits a bigger trend, right, Jade?
You know it does, RHONDA. We're seeing more retail and consumer-first health companies blur the lines with clinical care. Eva could make Everlywell a front door into the health system or a parallel pathway that bypasses it altogether. Either way, it shows how fast the at-home sector is moving upstream.
It's another signal that the front door to healthcare is shifting. Whether it's hospitals, digital-first platforms, or hybrid models, the race is on to define where patients turn first. That's all the time we have for today. Thank you for joining us on HITshow. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare.